I kindly request to stand on the protocol that has already been pronounced in the interest of time. And before I proceed to the speech that was given unto me to deliver on behalf of the Permanent Secretary, I'll kindly request that you allow me make my own personal remarks. Good afternoon to all of us. As introduced, my name is Rony Buhatungire, and I felt touched when someone mentioned that obstetricians usually tend to bias and swing things their way, and they negate other services. Yes, I am proud to be called or to announce that I practice as an obstetrician gynecologist, and I am not shy to say that, but that doesn't mean that we actually segregate against other services. I am here in three capacities. One, as a representative of the Permanent Secretary. Two, as a representative of the Director General Health Services, who was not able to make it because he's engaged in another meeting. The Permanent Secretary is away on annual leave, and so she was not able to make it, but she's here with us in spirit, and it's the reason why all of us are here represented. And then thirdly, I am here because this is my constituency. So I am very delighted, and I was actually smiling with Sylvester that I should have put on all my three tags, because I was invited in my individual personal capacity, but then also I am now putting on the guest of honors tag. Colleagues, a lot has been said, and I must say we had a very rich conversation with the panelists, and I would kindly request that we join our hands and appreciate them. Quite a lot has been said of what the challenges of national eye health are, and I'd wish to focus myself to a few of the concerns that were raised that were actually spoken through, but just for emphasis sake, bring them out here at the same time. We were told of the scarce distribution of eye health specialists across the country, especially at regional referral hospitals, where we currently are having 4 regional referral hospitals without specialists, and that is very true. And would wish to focus ourselves to one key question: why? A lot has been said about training, a lot has been said about resources, a lot has been said about capabilities, but I would wish to focus us to some of the key challenges that could be arising from within us as a fraternity. The Ophthalmology Association of Uganda. We need to do a little more in raising public awareness of the need for us to have this skill set acquired by many of us in this country. Dr. Rebecca Lusoviev spoke rightly about affirmative action that was taken for raising the critical mass in anesthesia. And I must say that it didn't come without a fight. It was the Anesthesia Association of Uganda that did a lot of advocacy. I was supposed to actually be recruited as one of the anesthesiologists, because they were recruiting people right from completion of internship, and they would take you on. They would entice you with a lot of aspirations within the anesthesia space. How much have we done as the ophthalmologists to woo people toward us? How much have we done to ensure that we have recruited as many toward us? If we create this demand, I have a feeling that we will have a little more people coming and embracing ophthalmology services as one of the specialty areas to undertake. The aspect of hospitals that are not delivering services, eye health services, despite the fact that we may have the specialists, this is actually very true. And a lot has been said about supplies, a lot has been said about resources, but I would wish to point this still yet to us as the ophthalmology specialists and practitioners. We seem to have relegated the role of advocacy to other people. I'm kindly requesting that let us embrace this as our own responsibility and make sure that we fight for our space. Hospitals, as was mentioned, have got a role of self-accounting, meaning that they are able to request for materials from the national medical stores based on their need and based on their requirement. And that is in the form of establishment of procurement plans. I would wish to challenge all of us here, especially the ophthalmologists. How much time have we invested in informing the procurement plans of the hospitals where we work? Because it's from the procurement plan that medicines and supplies will come to you, as opposed to center force and other lower level healthcare facilities that rely on a push budget. General hospitals, regional referral hospitals, national referral hospitals actually pull from the national medical stores, meaning that they are in position to work out their procurement plans, and they establish or they determine how much and what resources come to them. So this is a challenge to us to make sure that we participate in this space. If we do not participate, and the obstetricians, the surgeons, the pediatricians participate, we will see a lot of resources allocated there, and we will actually feel left out. But that is because we are negating our role in leadership. As specialists, let us make sure that we have established that as our responsibility in making sure that we call for resources and services to our space. Maintenance of equipment, that is indeed a responsibility of the Ministry of Health, and as the Ministry of Health, we've got regional workshops that are responsible for maintaining all the equipment at the hospitals, that is regional referral hospitals, downstream. And in case there is any difficulty with that, we also have the central workshop, that maintenance workshop that is established at Wabigalo, that comes into support. So in case there has been any challenges with maintenance of equipment, let us raise this, and I'm very glad that the Assistant Commissioner who is in charge of hospitals is one of your own. And therefore, let us make sure that we utilize him as much as possible, because then he will be speaking about a discipline that he actually understands very well. So Dr. Wasomoka, that is a challenge to you to make sure that you reach out to the fraternity and engage them to raise these concerns to us. And going by the distribution of healthcare workers or specialists still, I would wish to inform the country that the Ministry of Health has played a very critical role in making sure that we raise the relevance of national eye health services. And this can be seen in the new human resources for health structures that have recently been signed off by the Ministry of Public Service. Going by what the distribution of human resources was then, we had one clinical officer position established at Center 4 that was maintained. We had one position of a senior clinical officer, senior ophthalmic clinical officer, established at General Hospital, that was enhanced with two others, where we now have a principal, and we have the senior retained, and then we have an optometrist. So Dr. Naomi, you're doing a very great job, meaning that we have now created room to be able to absorb the people that you are actually training so that they can support in the refractive errors. The regional referral hospitals, which are the centers of referral for all the lower level healthcare facilities. Previously, we had 6 positions that were provided for. Right now, we have 33, including the super specialists and down to the support services, where we have nurses that are specific to ophthalmology services provided for. And currently, we have 33 positions that have been provided therein, where we have the extreme in a senior consultant, ophthalmologist, we have a consultant, 2 medical officer special grade positions, as well as the clinical officer positions that have been provided there, as well as optometrists. So we have done this. The responsibility to make sure that we actually fill up this structure is not going to be for the Ministry of Health, but rather it's going to be incumbent upon us as the ophthalmology fraternity. working together and raising awareness in each and every regional referral hospital and working with the leaderships of the hospitals to make sure that they prioritize recruitment of ophthalmologists or ophthalmology specialists and healthcare providers as priority healthcare providers. Because if you do not go and lobby for this, another discipline is going to come and lobby. And as has been highlighted, we have limitations on wage. So whoever comes and raises a need will actually be attended to. So if you do not come, I'm glad we have a hospital director here. He'll actually tell you, you usually have a very limited cake, small cake, to distribute among so many people. So whoever comes and actually demonstrates the need for the limited resources that are available is then that will be served. So as ophthalmologists, is it possible that we can now work together and make sure that we are able to raise this need so that we can be prioritized and have these gaps filled up? Okay. I loved the approach of integration. Colleagues, a lot has been done in the past where we have tended to specialize and where we have tended to support services in our own unique way. And you find that specialization that is ideally supposed to start at a hospital level had been taken down up to the lower level healthcare facilities, where you'd find a clinical officer who says, for me, I was never trained in ophthalmology services, and therefore does not even participate in the aspect of identification or detection of some of these conditions. And we have said here that there can be overt conditions that can actually be predicted by any obvious person, and then we refer to appropriate healthcare services. With integration, I believe we will have each and every healthcare provider develop the skill set to primarily detect and therefore be able to channel or refer appropriately so that we can have all the people in the country responded to as appropriately as possible. And I believe we as Minister of Health are doing quite a lot. Recently we had a meeting with one of the Chinese entrepreneurs that is seeking to establish a collaboration between the Ministry of Health Uganda and the Chinese entity in working out a mechanism where we can support telehealth services. And this is going to go a long way in trying to address that capacity gap where we've been having limitations of distribution, especially of specialists, and we will be able to send out these services, especially through the telehealth approach or using the mobile vans that will be used in screening out some of the patients and therefore appropriately referring them so that they can be able to receive the services that they are requisite for. So with this said, I've been in class myself, and thank you so much, Prof. Onyango, that you were able to school me, especially in ophthalmology conditions, some of the common conditions that are causing blindness amongst especially the children. And this is one of the things that we should possibly re-echo to the population that we need to be aware of. Refractive errors are very common, and therefore let us seek for services from appropriately suited people. Dr. Naomi did a very great job in differentiating or providing clarity on who is the right person to address some of these concerns. As a country, we've been having a very big challenge where people are doing things that they are not suited for. You find opticians doing an optometrist's job and dispensing spectacles that ideally are not supposed to be dispensed. What that does is, because the condition has not been rightly diagnosed, not rightly managed, that means you're going to be buying time on this condition, and that means you are going to delay to make the right diagnosis and therefore right intervention, and that could actually have far-reaching consequences like the blindness that would have ideally been preventable. So as a call to all of us for action, let us make sure that we do what we are rightly suited for. And this is also a call to all of us as a population. If you go to a facility and you're seeking for services, and these services do not meet your need at that particular point in time, seek elsewhere. As is usually said, when you seek for care and you do not improve within the stipulated time, you are advised to go and seek care so that you can be able to be advised otherwise. And therefore, thank you so very much, our panel of experts that was able to rightly deliver this narrative where we all were able to get scored. Colleagues, I kindly request that you allow me deliver the speech of the Permanent Secretary as was handed to me. The Country Director, Light for the World, the hospital, the Executive Director represented from Lago National Referral Hospital, the Hospital Director, Entebbe Regional Referral Hospital, now Senior Executive Consultant, the academia, both from Makerere and Mbara Universities, ladies and gentlemen, all attending today, I welcome you all to this National Eye Health Breakfast Dialogue, which has been organized by our esteemed partners, Light for the World. Over the years, we have run with the theme, Love Your Eyes, as guided by the International Agency for Prevention of Blindness Committee, and lately, the focus has shifted to child eye health. The Ministry of Health, with partners, are taking a strategic direction of inclusive eye health care, where eye health is not excluded, but rather included in all interventions, especially amongst children, to restore and preserve visual capacities amongst children. Uncorrected refractive errors, for instance, are the leading cause of visual impairment amongst children. Other conditions that have led to visual impairment among children, as has been highlighted, include cataracts, vitamin A deficiencies, retinopathy or prematurity, childhood glaucoma, severe eye allergies, and childhood cancers, as has been highlighted, retinoblastoma. Visual impairment among children heavily impacts on their general growth and development and leads to delays in achievement of necessary milestones. Children's vision is crucial not only to their education but also to their overall well-being. Poor vision in children can result in reduced school performance, missed opportunities, as well as diminished potential, whereby 80% of the learning during a child's time happens within the first 12 years of life. Therefore, investing in children's eye health is a direct investment in the future of these children. Unfortunately, however, children entirely rely on us as adults when it comes to seeking health care, and therefore they are a very vulnerable group. They cannot determine whether, when, where to access eye care, and therefore as adults, we need to take responsibility for helping these children access the necessary eye care they need. The Ministry of Health, along with the partners, continues to make strides in improving eye care for children through the following. 1, implementation of the fifth National Eye Health Strategic Plan 2021-2026 with the aim to eliminate preventable blindness and ensure access to eye care services. 2, the provision of a tetracycline eye ointment for all newborns that have been examined and found with normal vision at birth. 3, immunization against blindness, against blinding diseases like measles and rubella, which is known to reduce the risk of vision impairment amongst children. And 4, training of eye health specialists, especially optometrists, ophthalmic clinical officers, as well as other primary eye health workers, including teachers and village health teams that help in reaching out to the communities. Together with Light for the World, we as Minister of Health have supported the screening of diseases amongst children in the country and have been able to provide treatment in the whole entire country. And therefore, it is important to highlight the general progress that we have made in the past 1 year, where a recent rapid assessment of avoidable blindness that was conducted in Karamoja and Western Uganda attributed the dedicated partnerships between the Ministry of Health and all the eye care partners to a reduction in preventable blindness. It is therefore important that training of human resources for health with the number of ophthalmologists that is increasing is prioritized and therefore encouraged going forward. On behalf of the Ministry of Health, I sincerely thank you all, including our especially our partners that have been involved in delivering eye care services in Uganda to the benefit of the ordinary Ugandan. To the general public, I implore us all to always appreciate and protect the gift of sight, especially for children. I encourage you always to seek early medical treatment and avoid using of herbs. Reduce hours of our children that they spend on screens and other electronic devices, and only use medicines that have been prescribed within the hospital and healthcare space. I take this opportunity to reiterate the importance of eye care for our children, as it is very important because it shapes their future, and it is our responsibility as adults to ensure that they have the best start in their lives. As parents, educators, and health workers, let us prioritize children's eye health by ensuring regular screenings, early diagnosis, and timely treatment for vision problems. On behalf of the Ministry of Health and the Government of Uganda, I take the opportunity and honor to appreciate our distinguished partner, Light for the World, that has made this conference a possibility to bring to fore the opportunities that exist for us as a country to improve national visual and eye health services. Together, we can eliminate avoidable blindness and give every child the gift of clear sight and a bright future. For God and my country, on behalf of the Permanent Secretary, Minister of Health. Thank you.